Yep, Coflex, Coban is also known as. This is what we're going to use for post-wound treatment. I caution saying wound. You're not going to get damaged in this class, okay? It's not going to be a big gaping wound. It's a little poke. We're using the tiniest needle possible, which is a 23 gauge. Right here. The next two steps would be a pediatric needle, okay? This is the second to last for adult. Coban. This will be post-wound care. So to break this off, you just kind of stick your finger right in here and something like that. That's okay if it's like that, okay? Something about that long. I'm gonna set up everything to make it look nice and pretty before we start. And then these are sterile gauze sponges, okay? Put this right here. I didn't touch that yet. Okay, and so make sure that you guys need to know what glove size you guys are. This isn't the time to be macho or masculine. If you're a medium, grab a medium glove, okay? It will help. It will help your venipuncture tremendously. This actually you might.
He's going.
Someone else.
Oh, he says, no. Wait, do you have that big too? You said you don't.
Not all of us. We just need
If you can't, I can.
No, don't worry. No, this is a good example. Don't worry. Yeah. No, you got one right there. Okay. 23 gauge. Boom. Sterile sponges, sterile gauzes, but you know we're not practicing. This is not doesn't have to be sterile when it's touching the actual wound. It's just to stop the bleeding. Okay. This is the part that has to be sterile. This is your Vacutainer push button needle, 23 gauge, okay? And we're gonna have one of these. I have a picture of this up in your module already of what you're gonna need for each stick this semester. Again, none of this has to be sterile. I'll show you the sterile parts and what you need to be conscientious of. Okay, boom, boom. This is just in case for some people that need it. I'll show you different techniques. You guys can all see this? You guys are good? Okay. All right, something like that. Okay, we're good. And then we got everything. Okay. So, what I'm gonna start by opening up this needle package, and I want to introduce you to some things to you guys. This is what's inside. All of this we can touch. It doesn't have to be clean. You can let it touch everything. It's all good, right? Everything is sterile on here because it's wrapped. That's wrapped. This is the needle that's going into your patient. This is still sterile because you haven't uncapped it yet, okay? This is all not going in the patient's body, so it can be touched and dropped on the floor. It's okay. This part does need to be, I just want to, be completely clear, because when I was starting this as a student, I was like, oh my God, we're going to hurt somebody. Like, I'll tell you what to look out for. All this can be touched. This hub right here cannot touch patient once it's uncapped. You see this cap right here? This cap can be undone. You simply just have a nice firm grip and you have to kind of twist. There's no like screw like anything like that. You have to pretty much just put in there and it's held in by friction. I want to exercise a huge amount of caution to you guys for this piece. This piece actually contains a very sharp needle inside of this. My phlebotomist was Cassandra, right? Cass, this is what you guys used. There's the needle. I pulled this right off. This is what you can get stuck with, okay? Even through this, you can get stuck with it, okay? So don't be willy-nilly with it. You want to treat it as a very sharp object that can do harm, and you want to dispose of it only in the sharps container, okay? So you want to yell out sharps. I placed it right here. Some things will get stuck, like see how it's stuck right there, Lynn?
Yeah.
You want to just push it in, right, with your fingertips?
No.
Not at all. You're going to be very nice and gentle, and this thing going up will dump it into the bin below, okay? If it's packed up in any way, let us know. We'll get you a brand new one, okay? This, as you guys noticed, as I was talking this whole time, I'm very conscientious where this is going. This is uncapped. I need to keep this sterile because the contents are going to be going into your body through this way. Okay, so I never let this touch. This all can be touched, right? Everything is cool. It's not, doesn't have to be sterile. Only the hub part that this white part is touching. See how I'm holding everything? Now that I can't touch, okay? That one's gonna be nice and sterile. Once they're connected, and you connected, this sounds like a screw type kind of, it's called lure lock. Okay, once this lure lock is activated and touched and connected, now you can touch this hub, it's okay. Okay? All right, makes sense so far? Okay, good. All right, Lynn, let's take a look. Let's try, here's my spiel whenever I'm talking to my patient, okay? I go, hi, hello, ma'am. Your last name's Wynn, right?
Yeah.
Miss Wynn, is there a particular site that they go to when they're drawing your blood usually? Right side, perfect. I always have them pick for me, okay? Not only psychologically does it make them feel better about, you know, they're getting to choose where the damage is gonna be done, but they know their body's best. Just like you guys know your body's best, okay? So don't assume. So, let me go over this. This is tying a tourniquet, okay? For some of you that need to know how to tie a tourniquet, I go underneath and I just put the left on the bottom of the right, and you pretty much tie just one little bunny ear like this downward, okay? The reason why I do this, you can tie this many different ways. The reason why I do this with this little bunny ear going downward is because it's not having this flap. If I do it the other way, I don't even know how to do it the other way because I'm so used to, okay. If I do it this way, now I have this flap right here that's in the area that I'm trying to stick, okay? Is there anything wrong with doing it that way? No, I'm just trying to give you guys tips on how to make it easier for yourself moving forward, because we have to do this, okay, as a profession. So I'm gonna do it this way. I'll have the bunny ear and have it pointing downward, flap going up, okay? And what I have them do is I'll have them close their fist, okay? I'm not one of the techs, you can do this, but you know, they have like an orange like AJ has, and they'll have them like go like this. I don't like this, because let's try it. Can you go like that? What's going on when she's doing that?
It's moving.
It's moving. Well, how am I going to hit a vein if you're like moving it like that, okay? So I have a nice tight closed fist like this. The purpose of the tourniquet is to prevent the blood flow going back to her armpit region, axilla region, and there's blood pooling here now. I also aid it by kind of pushing the blood that's here in the wrist area, radial area, to the area that I want to stick in to make it a more plump vein, okay? So I'm doing this. If you guys see her elbow, look at her elbow. It's slightly bent, right? It's slightly bent like that. If it's slightly bent, do you think that's easier to hit a slightly bent elbow rather than a straight one? What happens if it's slightly bent, the elbow? What happens to the vein?
It goes down some.
The vein is also slightly bent. So there's a vein in here going like this. Instead of straight like that, you're hitting a vein that's kind of like that. Okay? A lot harder to hit. So I like it as straight as possible. That's comfortable. And the way I do that, instead of having her drop down like this, like we're doing a, what do we do? Drop this for like elbow. Yes, for the elbow. Instead of that, I'll just have her take her other fist, make a nice little fist, and then put it underneath like that. There you go. Beautiful, right? That's nice and solid. Won't move too much. And now look, after this time right here, of this tourniquet being on there, it's popping out a little more. I'll caution you guys to not just go for veins you can see. You want to actually touch a vein and feel it pop out. So I see one here and I see one here. But let's go and feel the difference on both. Alyssa, if you can feel this one right here, when you're palpating for a vein, she did it great. She did it perfectly. See how delicate she palpated for it? When I see people do vein palpations, they do this. They go like this. They're pushing down with both fingers and they're doing it hard. That is not the way to do it. You're literally just rubbing your fingers over their skin and then kind of just going over it. It's very soft, right? And so that's what I'm doing right here when I'm palpating for a vein. I'm not really pushing down. I'm here and I've seen a little speed bump. It's just a little bump that's going on over there. Then once I see that, once I've located that, I'll push just slightly and it gives me a little bounce back. That is good to go. You have great veins, actually, so that's no problem. Okay, so there's one right here, but I want you to contrast that by feeling this one, Alyssa. See, you see this one going down like that, right?
You can't feel it as
You can't
much.
feel anything, right?
Yeah.
Even though you can see it. You guys see both of these, right? So be very, very conscientious of, you want to have that feel, that pulsating coming back at you, okay? All right. You want it to be pushing back at you, and that's the one that's filled with blood, okay? Other than that, once you found your site, I like to, you okay? Okay. Got my glove. I like to, once it's tight, I'm not only feeling where it's popping out, I'm gonna go proximal, and then I'm also gonna go distal, okay? And what I'm doing is I'm mapping out in my head and then my eyes how this vein is traveling. This vein in Lynn's goes like this. It kind of does a little C shape right here, okay? So it's not a perfect straight vein. It kind of goes like this, and then it goes like this. This is very, very important. You need to know how it's traveling in our body so you know which angle to stick at, and then it disappears. I can't feel it anymore here, and I can't feel it anymore here. So here's my strike zone, okay? And the strike zone is like this, okay? So I'm plotting out in my head, I've got a straight object, and I'm going in at a little C object. So I need to come down here, or I need to be up here. That makes sense? Okay, so I'm gonna plan right about here. This is where I'm gonna do it, and luckily she has a little freckle right there. And I'm gonna use that in my mind. I swear to you, this is what I do with every patient. I'm looking at their skin and I use their own landmarks on where I'm gonna strike. Okay, and one last thing is this. This is the alcohol pad. I'm gonna rip this off. And then how are we gonna clean this?
Inside out.
Inside out, perfect. So there's my strike zone, right where that freckle is, and it's going like this. I'm gonna put it right in the middle, and then go in circular motion out. Perfect, just like that, okay? Let it dry, don't blow on it. All your spit, all your droplets that you guys just learned on is gonna fly right on it, okay? Let it dry normally. Can I now, after it's alcohol clean, can I now touch it like this? No. Beautiful, cool. You guys know sterile technique. Can I clean off my fingertip after I cleaned it? Let's say I did this. Clean off my fingertip with this alcohol pad and touch it?
No, just a bad idea.
It's just a bad idea? You actually can do this.
But it does, really.
Huh?
But your thing was on.
It is, yeah, but not while I'm doing it because I'm presenting, right?
Oh, okay.
Yes, it is fine to do that, okay? Because you guys are going to do this, and then you're going to be like, ah, this happens every class. You're going to be like, oh, I don't know, I had it, but I don't remember. Let me feel, and then you're going to be here all day just on my day. It's going to happen, I swear to you. Okay, Lynn, are you okay? I'm good. Okay. Okay. So I'm going to do this. Thank you for volunteering for this, by the way. Okay. All right, so again, right there and right there. Okay. So I'm going to find my injection point, and when I'm ready to stick, I'm going to uncap this, and now this cannot touch anything, okay? I will have my, there's little grips on this butterfly needle. You want it pointing down, and that will give us a nice beveled edge towards the top, okay? There's the freckle. I'm going to kind of secure the vein right here. I kind of lock it down like that. And I go in. And what I'm looking for is this right here. This is the key. This is called flash. You guys saw that? See it, Alyssa? Once I see the flash, I'll pull the syringe backward. I'm not moving this. See how steady I am with this hand? I'm moving this backward. Once I see this inside of the syringe right there, you wait for your instructor to say okay to inject, and I'll go ahead and give them some of their blood back as well as the saline solution. And that right there is a successful stick. I'll hold it like that. I've never moved this. You saw how careful I was with it. And then this, if there's a little button on top right here that retracts it, okay? That keeps it safe. I'm gonna ask her if you can help me. Can you hold this down while I get rid of my sharps? Then I'm gonna be very careful with this. Even though there's nothing exposed, it's pretty safe. sharps come right in here. I don't have it go down. Okay. And then now that she's holding it, thank you so much, Lynn. I got this co-bound. The way that this works, it's going right here. It's like a second skin. It sticks to itself. It won't stick to the skin like that. It has to be wrapped all the way around. And then that's how it sticks to itself right here. Once it touches itself, it's like a second skin. Okay? That's nice and good. Boom.